We have a very young 69-year-old with back pain, leg pain, and neurogenic claudication. She's got a L3-4 spondylolisthesis with a little bit of lateral listhesis, a trace 4-5 spondylolisthesis with severe spondylosis or degenerative disc disease, and she's got a lot of sclerosis at the front. Basically, this is a kissing anterior column, so when she's standing for a long time, leaning forward, leaning back, this disc is no longer acting like a shock absorber, and there's a lot of pressure on the front of the disc space, and because of that, it gets more and more dense, and it builds bone spurs. So we'll utilize a minimally invasive lateral approach so that we can really realign these disc spaces and get her taller again and pull everything back. That will also achieve an indirect decompression. Here's the MRI. You can see the modic changes in the front of the vertebral body at 4-5. You can see the spondy at 3-4, and you can see how bad the facet joints are. The stenosis when she's lying down is not that bad, but I suspect when she stands up, this slips forward, and the dynamic area here gets much smaller when she's standing up or leaning forward. Here's a CT scan. You can really see the sclerosis and the degeneration at the L4-5 disc. And you can see the spondy obviously at 3-4, along with all the crazy bone spurs. And you can see in the CT scan, the stenosis is much more obvious. So we're all hoping for a great result. If all goes well, she'll be able to go home probably tomorrow morning or shortly after lunch. We're all prepped and draped and we're about to get started, but before we make any kind of incision, we have a process called the timeout. Everybody stops. We go over what the plan of care is, make sure that everybody on the team has everything in order and there are no concerns, and once everybody's in agreement, the timeout is completed and then we can get started. It's just like Formula One, basically. One more of those? Not yet, almost though. Okie dokie, let me have a knife starting This is really like cheating. I'm sorry, but it is. Right there. Doing the discectomy at 3-4, this disc is, let me think of the medical term, cock-a-poo-poo. But we knew that. I don't know if you can see down this really deep hole, but it's only about that big, the circle. Because that's how big the cage is. So why make the incision bigger? Oh, I know why, so you can see. Ha ha! All right, here's the implant. It's radiolucent, so we'll be able to see the bone grow through it. Here's the big opening for the bone graft. So if you're wondering, I wonder if that's the top of the line, most expensive bone graft that's available. Yeah, because that's the way we roll around here. Everything is the absolute top of the line best. We can't help ourselves.
Bone?
Let me see it first. Hold on.
Retract your right thumb, please.
Alrighty, surgery's going really well. You can see we're done with the side part of it. So there's two 1-inch incisions on your side with a little poke hole near your hip pointer. It's a thing of beauty. And then, I don't know if you can see the x-rays, but you're gonna feel really, really tall. Alrighty, I've exposed the facet joint, the pedicle entry point, and the laminar entry point on the inferior articular process for the Karma device. It has to basically cinch down the facet joint. I see the facet joint, I see the pedicle entry point. This is going to be perfect. Alrighty, I've made the curved drill hole. And now I'm passing the device. There's a little ball tip marker. It'll just basically go around. And then it'll go. And it'll make that exact sound too, I promise. Shot. 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 And I will be able to cinch this down just to my heart's content until it just gives it a big, warm bear hug. In there, and I'm pulling on it. Oh, it is so stable. It just cinches it down. I love that long old time. Okay, let me have the cutter. And it's zero profile. Once I cut this little tab off, it'll be completely smooth. And you'll just want to lay on it. You wouldn't want to lay on big... Oh yes. Save that, obviously. This drill is so much better. I love this. Shot.
Say that one more time, also.
I love the new drill. It works so well. Shot.
It's coming to you, Jason. A little bit further.